Welcome to Wellness Academy Audio.
How's it going, everybody? This is Dr. Chris Riedel with Wellness Academy Audio. We're a group of wellness professionals trying to continue to improve collaboration in healthcare while providing education to everybody. I'm here today with Dr. Vincent Williams, who is a dentist that has extra training in full mouth rehabilitation, wisdom teeth removal, and sleep apnea. So how are you doing today, Dr. Williams?
Doing good. Happy to be here, Chris.
Happy to be here. Where can I find you today? Are you at home or are you at the office?
I'm at home. The office was a little hectic at the end of the Friday. It was a crazy week, so I came home, just sitting in my kitchen right now.
So it was a crazy week for you?
Yeah, there's a lot of complex cases, some tough things, but we got through it. We've got a great team, and it's taxing on the body and the brain, and so you're kind of exhausted by the end of the week, but that's what the weekend's for.
I can imagine. What do you find, I guess this tangents us, but how do you keep yourself mentally sharp and feeling good through such a physical career?
The number one thing, it helps both mentally and physically, is exercise for me. I'm in the gym Friday, Saturday, Sunday. Those are really the only days I can go. But when I'm in there, I'm training pretty hard, and it's kind of like exhausting the body, resets the mind a little bit. I like to listen to podcasts or music and things like that while I'm working out. And I've found that I really have to put time into non-dental things. I need to shut off the dental brain for a couple of days so I'm recharged and back ready for the week ahead. So that helps a lot. Definitely exercise for sure, but hanging out with my wife, playing with my son, my dog, traveling, being around family, those are all things that help keep me going.
Kind of give you energy.
Yeah.
How old's your son now?
He is 20 months. He'll be 2 in December.
How's
Time
everything
has
going there?
flown. It's great. Now that he's sleeping through the night, I have very few complaints. He's very easy. We're very blessed. It could be much more difficult than it is. You don't know how much fragmented sleep affects you until you experience it. Your patience is limited, your fuse gets shortened. You just can't handle as much without kind of losing it. And so now that he's easily sleeping through the night, it's so much easier.
Yeah.
It only took
Oh,
18.
yeah, that's true. We have a 9-month-old. I guess he's about to be 10-month-old, and he's really, his sleep is starting to improve, which is very nice.
Yeah.
But it is crazy. The impacts of sleep on total health are insane. When you look at injuries, the amount of patients that I've had that present to the office just because, like, young dads, or of course, now I don't focus in the postpartum, like so my partners, Dr. Lauren, and then of course Dr. Maria at the office focus on postpartum, but even just some dads where you have that clockwork where they're sleep deprived, and then all of a sudden they're sitting on some of those big comfy couches that are uncomfortable. It's 3 a.m. in the morning, and they go to stand up, and all of a sudden their back goes out, and a lot of the component is just sleep. I think the poor sleep causes a lot of issues, and pain is one of them. It actually sensitizes the nervous system. But let's dive into some of these topics. What initially drew you to dentistry?
My uncle is a dentist, so dentistry has always been kind of on my radar. My mom did a lot of bookkeeping and, payroll and things like that for his office. So there were several times, some of my earliest memories, I remember going with her to work to his office and just hanging out while she did, what she needed to do. And so it was always in the back of my mind. And then kind of as I got older and as I start, thinking about what I want to do, what do I like to do, I started comparing what I like to do with, does dentistry check that box? And so it was like, all right, I like math and science. That goes directly into, healthcare and dentistry. I like working with my hands. I do that every day. I like interacting and meeting new people every day. I meet with and talk with interesting patients every day. And it also I need variety. As a general dentist, I get to do a variety of procedures. I'm not just doing the same thing every day. I get bored really easily. And so having a wide variety of procedures to do and topics to dive into and learn more about keeps me interested, keeps me going and passionate about it. So, yeah.
That's it. Since you've had that history of watching dentistry, have you noticed that the profession has changed, or how has it evolved over the years?
It's absolutely changed. Back when my uncle first started, just, talking with him about how that was, young dentists had the ability to go, hang a shingle. They could build an office and build a patient base and build a practice just anywhere almost, as long as you had a population to treat, and you had the skill set to treat those needs, you could make it. Now, it's a lot more difficult. There's a lot more corporate involvement, a lot of corporate offices and things. So the market share is different. The demographics are very different. It's better in a lot of ways. We've come a long way. The technology we have, the techniques we have are massively improved, which is great for patients and great for dentists. The business aspect of it is a lot more complex. Insurance is very complex. So it's evolved in good ways and in not so good ways, but there's still avenues for those that want to be in private practice and want to own their own business and everything. So you just have to find the right niche and the right area, and you can make it work. It's definitely a little more difficult, but it's doable.
Do you feel like the addition of all these corporate offices, that's something I hadn't thought about before, but do you feel like the addition of the corporate offices has led to any changes in the way the patient is treated or in patient care?
I absolutely do. I've had instances myself where we have patients that come to our office and that didn't have a good experience at a corporate office, or even just another private practice that's still, owned by a practicing dentist. And it's tough when you take someone who's not directly involved in dentistry and in providing care, and you kind of remove the human element of it, and you start only looking at numbers and what does it take, how much do we need to produce each month, and how many of these procedures do we need to do. It's like, yeah, that's important, but you can't do those procedures if those procedures aren't necessary. And that patient is a human. They're not a number. They're not a wallet. You have to treat their specific needs. Every patient is nuanced. You can't just break it down to a simple, oh, I need to do this many crowns to this month. And if the crowns aren't needed, you can't do that. And when you start only thinking about how much do I need to produce or things like that, and you stop focusing on the patient, your outcomes are going to be terrible. Your patient experience is going to be terrible. And that's where I think a lot of people get frustrated, where you've got someone who's not directly involved in providing the care to the patients is telling the provider what they need to do or how they need to treat the patients. You're taking away some of that autonomy. And when you do that, it's not fun anymore. You want to be in charge of yourself. You want to work with the patient and provide the best care for them. And when you've got an outside entity that doesn't necessarily understand what it takes to do that, it can be very frustrating. And I think it can lead to burnout and just overall distrust.
Yeah, I think the core concept there, and you said it 100 times, was it's important to be patient-centered.
Yeah, absolutely.
Focusing on the patient's expectations first, meeting the patient where they're at sometimes, and making it so that your care is exactly what that patient wants and needs. With that being said, you kind of opened up a can of worms for a question that I don't know if the dental profession will want to hear your answer. Is what are the most common procedures you see performed that might not need to be or are advocated that you find were unnecessary?
It's so tough to identify, was something unnecessary, because the only thing I have is the information that I have. I wasn't there when the patient was having this initial conversation. I only have the information right then and there. What am I looking at? And dentistry it's very nuanced. They say you put 10 dentists in a room and have them all look at the same patient, you're going to get 11 different treatment plans. You're going to get 11 different ways to treat that patient. And so there's not one right way to do anything. It depends on what works best for you, what works best in your hands, what do you have the most experience with, what's more predictable. That's what's important, predictable results. And so it's tough to say is something unnecessary. I don't know if you have all the information and necessarily be able to say that, but I feel like a lot of patients feel like they're being sold some things sometimes. I feel like patients feel if they're being told they need like a deeper cleaning, like a scaling or root planing or things like that. The issue is when the patient doesn't understand why it's being recommended. If you can't get across to that patient why you're recommending a specific treatment and you can't get them to understand the value in that treatment, they feel like you're selling them on something. And so I think some of that comes down to time with the patient as well. If you are dealing, if you're in network and you're dealing with a lower reimbursement and you now have to see higher volume in order to keep the lights on, to pay the bills and pay your team, your time that you get to spend with each patient is going to be limited in that aspect. And I don't think that's a good thing, but it depends on the environment that you're working in and the business model that you're working in. Sometimes you got to just do the best you can. But I think patient education is one of the most important things. If you can get the patient on board, if you can have the patient understand and truly believe in the value of what you're recommending for them, nothing's unnecessary at that point. It's you and the patient have to decide what's right for them. And as long as they're on board, then that's the best.
Yeah, that's really interesting. How do you feel like that impacts new providers who are just coming out of school and they're joining a big corporate practice?
So I think that the toughest and most difficult change in the dental landscape that I've seen and heard from patients and I've heard from other practitioners myself, when you've got someone that is just, focused on the numbers and is or really really pressuring these newer practitioners to that they have to produce, they've got to produce, you come out, you've got a lot of student loans, you've got bills to pay. It's you kind of are forced in some instances, or you feel like you're forced to maybe do some procedures that you may not have full confidence in being able to deliver, or may not have the experience to be able to do it efficiently. And that puts a lot of stress on the dentist, the provider, but it also puts a lot of stress on the patient. So if you're trying to get a tooth out and it takes 2 hours, I've had patients tell me that. And sometimes patients aren't the best, historians, the best reporters, and they can kind of conflate, what actually happened. But when I first started out, I had extractions that took 2 hours. And should it? No. But I was trying to do what was best for that patient and trying to get them taken care of. And so that can lead to a not so positive patient experience, and also a little bit of distrust too, because they can feel like you're trying to offer or do procedures that you aren't qualified to do or shouldn't be offering. And it's a tough thing to balance and to manage. And that's a difficult thing to attack, because that's a little bit, should our dental education change a bit? Should the landscape of dentistry, the business side of it change? It's a very complex issue, but it's an issue that needs to be addressed, I think.
Yeah, I think one of the challenges is making sure that people have opportunities to get the experience performing a lot of these procedures. But when you're in healthcare, it's kind of hard to dictate that, because not everybody has the same resources. Like at most hospitals, you have this amazing residency programs and amazing internships. And a lot of these are thanks to relationships with the medical schools, with the hospitals. And so a lot of other professions try to mimic that. But I think that's why medicine has the reputation it does. But those hands-on experiences, the hands-on experience is everything to get the procedures. Like I made sure I worked at a cash chiropractic office when I first graduated. I treated high volume, which isn't how I treat right now, but I would see 60 people a day just to master my craft. But nobody ever likes the sound of somebody getting their first experience with a treatment, especially a 2-hour tooth removal.
Yeah.
That doesn't sound very fun, but
It's not fun for anyone involved.
no, I can't imagine it's fun for the
Yeah.
practitioner or the patient,
Yeah.
but
But
you've
you've got
to,
to get the reps in. You absolutely have to get the reps in. You've got to pay your dues. You've got to if you don't feel comfortable with a procedure, you make a choice. You either get comfortable or you choose not to do that procedure.
yeah, exactly. And that's where things are tough. But let's
And
talk about, so you have extra education, right? So you have your doctor of dentistry, but you also have extra training in wisdom tooth removal. Do you mind telling me a little bit about that?
yeah, I went and trained in Utah, Western Surgical and Sedation with Dr. Hendrickson, and was a pretty intense course, but we got to do some hands-on treatment, hands-on continuing education. Like you said, hands-on experience cannot be matched. I mean, you can lecture all day, you can read the textbooks, you can, until you do it, until you get the feel of it, and until you get your dirty and actually put the reps in. Like I said, you're not going to feel confident. You're not going to be efficient at providing whatever procedure that is. And so that is honestly one of the best courses I've ever taken, because I mean, I can't even remember how many impacted wisdom teeth we removed that week. I worked directly with a partner, so I got to assist my partner doing the procedures, but also seeing it from the assistant side, which was great because I was able to come back to the office and train my assistant as well on how we're going to do this procedure and how we're going to provide it, and learning from the patient side of it as well, being able to watch and see how the patient experience was based off of, with the sedation and things like that. It helped me kind of critique and evolve that into my own way that I do things. And it's one of my favorite procedures to do. I really, really enjoy doing it. It's a huge service that it needed to be offered, especially in a rural area that I work in. Patients don't want to go to another office. They want to stay with you. They want to see the person that they're comfortable seeing, even though they may not understand they may need to see a specialist sometimes. But I'm very selective with my cases, and I don't do any procedure I don't have 100% confidence that I can deliver on. But it's a huge service because people don't understand how complex with impacted wisdom teeth can be. And the older a patient gets, the more difficult that removal can be, and how dangerous and sometimes even deadly an infection can be, especially if it moves into the spaces like under the floor of the mouth and things like that. It can close off an airway. I mean, there are patients every day that have to go to the ER and get on IV antibiotics because they can't breathe because of the infection just spreading to other places. And it's something that could have simply been done when they were a teenager. I usually have all four wisdom teeth out in an hour. An hour procedure could have saved someone a trip to the hospital, and that's huge. So being able to offer that for our patients is really important to me.
So tell me a little bit more about wisdom teeth. I understand the concept. You have the human jaw formed, and we have these extra teeth that come in. But because of the shape of our jaw, we generally need them removed because there's not enough space. Do you mind telling
Not
me
enough
a
room.
little bit more about that? Because it's definitely not my expertise.
Yeah, it's a very complex issue that I don't think we truly understand from an evolutionary standpoint. Most people theorize that it has to do a lot with our diet, and the more processed foods and things that we eat, we don't have to chew as hard to process our food and things like that. We don't need as many teeth, and our jaw has now kind of constricted. And so we've lost some of the space going towards the back of the mouth. And so now you have these third molars that are trying to come in, and if they're blocked out, they don't have the room, or they're coming in at an angle, or if they're deep impactions and things like that. If they don't have the space to come in and they're stuck, that leads to a lot of potential issues. If there's no bone, if the tooth is fully encapsulated in bone, that's not as big of an issue because it's covered. There's not a space around there for things to get trapped or issues to arise. You're not going to get a cavity in a tooth that's not exposed to the oral cavity. But if there's enough room, or that bone between the tooth in front of it has been eliminated, now there's a giant pocket where anything can get trapped under there. That tooth can get a cavity under there. Even though you can't see it, it's a festering issue that's gonna, one day it's gonna blow up. And if that tooth is fully formed and it's closer to that nerve, that's a risky procedure at that point, especially in an older patient that their bone has reached peak density. So now it's more difficult to remove that tooth. If the tooth is very, very deeply impacted, and now you have to remove a lot of bone to get this tooth out. Now we sometimes have to worry about pathologic fracture of the jaw just because we've now weakened that area of the jaw. And so a hit, or just chewing on something crunchy or hard, you hear a pop and the patient comes in, you're like, oh my gosh, now the jaw is fractured. Now they need orthodontic surgery to plate this to get everything back together. It can so easily be prevented. It really can. prevention is key. And being able to recognize when not every wisdom tooth has to come out. Not just because you have a hammer, not everything is a nail, but you've got to be able to recognize when that needs to be addressed and when that needs to be treated, because you can save the patient a lot of time, pain, money if you address it early.
Is it, how can you tell if one needs to come out or not? Is it just based on the fact that they're coming in and you're starting to see that pocket, or?
So some patients actually don't even develop wisdom teeth. I've got patients that only have upper wisdom teeth or only have lower wisdom teeth, or they only have 3 instead of 4. And so some patients like me, I have all 4 of my wisdom teeth still. They fully erupted. I mean, they're in occlusion. I chew with them. I have enough room. I have a giant mouth. I've got a big head. I've got room for it. Not everybody's like that. And so you can usually see that as the patient's growing and as the patient's developing, but also the angle that they're coming in at. If they're coming in, we call it mesial angular, so they're angled towards the midline of the face. They're coming in this way instead of straight up. You can see where that tooth is caught in either the curvature of the tooth in front of it, or you can tell when that there's not going to be enough room, and you've got to have that conversation with the patient. It's like, look, we may not know 100% are you not going to have enough room, but I do know there's a window that I can get in there and easily remove these teeth for you, and make this a very easy experience for you with some sedation. I can get in there very quickly, remove these out quickly but safely. But the thing is, like, quick removal, being, efficient with the procedure, the shorter amount that wound is open, the less chance there is for infection, the less chance there is for a complication after the surgery. So getting in there and being efficient and removing them in a timely manner is also super important too. So if you catch it when the tooth hasn't fully formed, the roots aren't fully close to that nerve yet, they're above the nerve, it's a low risk, they're formed well enough, they're not going to be pushed into the sinus and things like that when it comes to the top. When you can identify those things and get those patients timely treatment, you're giving them such an amazing service, and you're saving them so much in the long run.
So is there a correlation between smaller jaws and the need for wisdom teeth to come out? Is that something that you notice in practice, or is it a little bit more?
It's more complicated than that, but if someone has a constricted jaw, if they don't have room for the teeth that are fully erupted in their mouth, they're not going to have room for their third molars trying to come in. And we've learned a lot in the past few years about how important expansion of the jaw is to kind of help guide that growth and prevent, those high vaulted arches and constricted high vaulted palates and constricted arches, because now we know so much more about airway and how invading the tongue space and things like that can lead to airway issues and sleep apnea issues, and how that's just a cascade of negative effects for patients long term. We know so much more now than what we did. And so something that would have been a watch and wait, now we understand, no, this is not a watch and wait. This is a get in, this is a take care of it, because we're saving you a lot of headache in the future, literally and figuratively.
Yeah, I think you and I have talked about this a couple times, because maybe 3 or 4 years ago, I read that book, Breathe, The Lost Art of Breathing.
Yeah.
Right. And so in that, he talks all about the evolution of the jaw, of the face. Of course, as hopefully we're getting smarter, we have a larger frontal lobe, which requires more space. And that takes away from our sinuses. It takes away from it's not going to take away from our eyes, but it takes away from our jaw. But then that combined with the fact that we're not chewing as much as we used to, I always think that's kind of interesting. We're talking evolutionary, so we're talking over thousands of years, right? We're not talking about just since 1700. But one of the theories was we started eating processed foods early on in our history. But before that, we were probably gnawing on bones and stuff like that. Have you heard anything about, he even mentioned, I think there's like some wood blocks that that you can chew on to help develop your jaw. Have you heard anything about those?
I have. It's such a complex issue that I don't know if something, you can't just throw something like that at it. It's not necessarily just the act of chewing. It's also has a lot to do, the way the arch forms and the way, you develop, your skull develops and things. It's from birth. I mean, you can look at the difference between, bottle fed babies and breastfed babies and the way that arch forms. And there's habits that can affect it too, tongue thrust, thumb sucking, things like that, that all have to do with how that arch is going to form out into that. We want that nice rounded U-shaped wide arch. There's so many things besides just chewing that go into it. Yeah, that could help some things, I'm sure. I don't know. I'm never going to tell my patients to go chew on wood blocks. I have to tell my patients not to chew on ice all the time because it just destroys your teeth. But it's such a complex issue that it's so multifactorial. There's not one fix for it. And that's why it's often involves an interprofessional team to truly correct it, because there's not one factor that's leading to this. It's so nuanced, it's so complex, and we have to be able to recognize that and understand what's our role in that team and make sure that what we can't do, that patient's getting to the other person that can help them. Myofunctional therapy, physical therapy, orthodontics, orthognathic surgery. I mean, it's a very complex issue that can't be treated with any one silver bullet. It's not going to happen.
Yeah, I think I also kind of strawman what the book was suggesting with
But
the
yeah,
wood
no,
block thing.
and it's also difficult because there's a lot of controversial research and the way that the research was gathered and the conclusions that come from it. There's a dentist named Weston Price that a lot of research and things like that came from. Man, if you look at some of his practices, that you probably wouldn't agree with some of the conclusions he drew or some of the other things he did. There's a lot of battles we have to fight because of some of his research methods, not even just to relation of jaw formation and things like that, other things like endodontics and root canals. And there's a lot of conclusions that were drawn based off of his research that were not done properly. I think a lot of that research can't be replicated and shouldn't be replicated because it's some of it's unethical, some of it is not good scientific method. And so we only know what we know. We don't know what we don't know. And we've evolved to understand how we should research things. But some things are very difficult to research as well. And so we can kind of only go off of what we know and what we've experienced and try and move forward in the most ethical and practical way. It's difficult.
Well, to be honest, a lot of these things are really complicated because most of your research is going to be performed on adults, and genetics is the wild card in the corner, just looking at everything. So when you're trying to make a statistical difference, it's going to be very hard in an adult when the jaw and everything's already formed at the same time. But I kind of want to pivot back because you said a couple things that are really interesting. And I think that jaw formation is something I really want to dive into because it's a core of a lot of the topics we're going to get into. But you mentioned that breastfeeding versus bottle feeding can result in different jaw formation. Could you elaborate on some of those?
It's super multifactorial again. We have the issue of tongue tie and lip tie and things like that comes into it. If a baby cannot latch, there's multiple issues like, okay, why? And is it the tongue? Is it the lip? And if they can't latch and they're going to be fed by a bottle, just the comparison of the bottle to the nipple and the suction that's formed is different. You can do your best to try and replicate that the anatomy and the physiology that goes into what it takes to make that the same kind of relationship between that and how it forms the jaw. We have research to show it. Nothing beats the breastfed baby in the terms of formation of the jaw and formation of just the physiology behind it and how it influences the way the skull forms, the way the jaw forms, the way, and also it comes back down. Now we've got a breathing airway. Nasal breathing is going to really, really influence how the skull forms and the jaw forms, mouth breathing and things like that. It's such a complex issue that's really, really tough. And not every baby can breastfeed. And that's what we need research. We need development of products and things for those babies that can't be breastfed for a multitude of reasons. It can be, there's no way to nail it down to one thing. and we've got to do our best. There's many smart people that are working on this, trying to come up with products that can get as close as possible, because we've learned it's got such a huge influence. And there's so many smart. I don't come up with hardly any thoughts myself. I've copy genius wherever I can. I'm not smart enough. I'm not spending the time to do these research, and so I try and learn from the people who do, and the big names in our dental industry and in the research that understand these pathways and the physiology behind it, and just try and break it down and make it understandable for other people. There's not a whole lot I can do to help with that, except for trying to myself understand it. It's a very complex, very multifactorial issue, and we're working on it, but we don't fully understand the problem. We understand there is a problem, but I don't think we fully understand what the problem is and where the nuances are. But we have plenty of data that shows the differences between the two, and we're trying to bridge that gap between the two. And even when you can't, we know early intervention, even with orthodontics or with guided growth and jaw formation, expansion, and things like that, we can make up for any lack there in the beginning stages. We can, just because the baby's not breastfed doesn't mean there's no hope for them. It's we have a lot of tools at our disposal to help them catch up and get to where they should be, but early intervention is key, and recognizing when you need to intervene.
Yeah, that's really interesting. Would pacifiers be another thing?
That's another big issue, because just that constant force, the way we get teeth to move in orthodontics is force applied over time. You need force, space, and time to move a tooth. And so when you've got a constant force, that constant sucking motion, it could be the thumb, it could be the pacifier. When you've got that forward push, or the way those forces are, you can look at models or a skull from a baby who had a thumb sucking issue or a pacifier issue where they just used the pacifier for way too long. You can see the way it causes the jaw to develop and causes a flare of the upper incisors, mainly that maxilla. Just it's easily observed. It's hard to know what are all the nuances that go into how that mechanism of action and how it's truly affecting. We know it affects it. And again, you've got to intervene early. You've got to recognize when you need to jump in, because there is a point where intervening is less predictable.
So would intervention in the perspective of a child be braces and
Yes,
things like
there's also
retainers?
things like that. When you see that patient who's got deficiency in either the upper or lower jaw, you've got to intervene and help that jaw form. It could be orthodontics. Some patients, if they're beyond what orthodontics can do, if those sutures have closed and fused and things like that, now we're talking orthodontic surgery and things. And some patients, orthodontics is not enough. If they're truly severe, if it's a developmental deficiency or developmental issue, skeletal issue, there's only so much orthodontics can do. And at some point, you have to tell those patients, like, look, you're a surgery case. Like, we are going to have to put your skeleton, take your skull and move it into a better position. Nobody wants to do that, but you've got to understand when it's necessary. And if you can intervene early, sometimes you can avoid having to go to surgery and things like that. But not everybody has the resources. Not everybody has the ability to get that early treatment and things like that, just based off of where they live or finances or just lack of care. And so we've got options, we've got good things that we can do to intervene, but the earlier you can, the easier it's going to be to correct. But again, every patient's completely different. Every patient comes from a different background, has a different story. And so you've got to understand that story, understand where they're coming from, and then curtail your treatment to that and just try and help them out the best way you can.
So another thing that you mentioned that I thought was interesting is you mentioned the airway and how the development of the jaw, all these things are developing together. And so you mentioned that by nose breathing, that can actually alter the jaw. Do you mind elaborating on that?
Yeah, it has an effect on jaw formation and jaw development as well, just based off, again, forces that are being applied in different areas, the way the muscles are applying forces to the bone, and the way that things are forming over time. We also have issues with, patients who are chronic mouth breathers. We're going to see gingival inflammation. Those patients are way more likely to have gingivitis. Those patients are way more likely to have dry mouth issues and things like that. They're way more likely to have, decay because of that, because there's less saliva bathing the teeth over time, getting the sugar and carbs off of the teeth. And so the bacteria has more time to work. It has more time to do damage. And the way the body adapts to whatever you put it through is difficult as well, because patients are going to find a way to adapt with what they've got, work with what they've got, do the best with what they got. And so I know you and I have had to talk about posture in patients, and like posturing forward for patients who have a smaller airway, and they're reaching out, trying to open that airway up and make it easier for them to breathe. They're trying to survive. It's a fight every single day, but that's the way their body's gonna work with what they have. I mean, their body finds a way to adapt in a lot of ways. Sometimes that's a good thing. Sometimes it's a bad thing. Sometimes it works against us and it makes it harder for us to correct things. But it's a very, very difficult thing to first identify and then second treat. And again, it comes down to a lot of what does the patient have? What kind of care do they have access to? What team are they working with? What are finances? It's a very difficult issue, but we've got a lot of great options now because we know a lot more about it.
Yeah, I think it's a lot of people have no idea. And I always feel bad because they always say when you go to a chiropractor, a physical therapist, or even healthcare in general, you're going there to get told what you do wrong. And it kind of makes me feel bad because it's like, oh, I can't even breathe right. But the reality is, a lot of us are breathing too much through our mouth. And then we're also breathing too much through our chest.
Yes.
And so you actually see some of us, we get that like really tightness in our scalenes here because we're chest breathing. All of a sudden we're getting cramping when we go for runs and things like that. When we actually want our diaphragm to drop and expand when we breathe. I mean, you don't necessarily want to belly breathe, but you do want your diaphragm to drop, and that will result in expansion of your lower torso. In order for that to happen, a lot of this starts with breathing through your nose because you're actually meant to do that. But a lot of us breathe way too often through our mouths, and this can cause a lot of issues down the road as well, where our airways aren't clear. But it's interesting. There's actually it's more mechanistic research, so I'm not going to say this is the end-all, be-all, highest quality, but there's actually research that gets into the fact that if your diaphragm isn't moving and you're not utilizing it and you're not breathing correct, your core actually might not activate to the same extent, which I think is really interesting concept. It's starting to be challenged because a lot of these things are, as you say, multifactorial, very complicated, but it's very interesting. I think sometimes also diaphragmatic breathing results in better oxygen saturation and all sorts of things. So I think the fact that you could make an argument that everybody that comes into an office should start with just breathing education is really interesting, but also very humbling. But do you mind explaining to everybody what your ideal resting jaw position should be?
So every time I tell a patient, I get crazy looks every time I ask a patient. I'm like, how many minutes in a day, in a 24-hour period, do you think your teeth should be touching? And I get some crazy answers. They're like, an hour, 10 hours, things like that. And when I break it down to it, it's like, it's about 15 minutes, honestly. Unless you're chewing, your teeth shouldn't really be touching. We want your tongue should be raised against the palate in a rested position. Your teeth should be slightly separated and your lips should be closed. That's the ideal position for your tongue to rest. That's the ideal position for your jaw and relation to the muscles and the joint. And then also lips closed, so you're breathing through your nose. So you've got filtered air coming in. When you breathe through your mouth, there's no filtration. We have hair, we have mucous membranes, we have so many mechanisms built into our nasal cavities that filter and treat the air that goes into our body before it gets to everywhere else. And when you're breathing through your mouth, you're bypassing all of that. And so that's such a huge thing. But again, patients don't know what they don't know. And I think like a lot of what you said is when you go to the doctor to be told what you're doing wrong, that's true. But it also has a lot to do with how you're presenting it to the patient. I mean, don't present it as you're doing this wrong. Present this. The way I talk to a lot of patients about sleep is like, I just start asking questions. I'm like, do you wake up with headaches? Do you feel rested when you wake up? Has anyone told you snore? Do you wake up multiple times in the night? Have you been told you stop breathing? And I let them kind of lead me along. It's like, yes, no. And based off of that, I know where to go next. I'm like, well, these are some of the dental cues that I'm seeing that lead me to believe you may have an airway issue, or you may have trouble breathing at night or during the day, or you may have a habit that's affecting that. And then so I can take it from there. And then the next best thing to go to is a sleep test, because now I can take my theory, what I'm, postulating myself, I can put numbers to it. I can put data to it. And I can say, I this is what I think, but now I've got data and numbers to back that up. And we can show that. And we've got so much research that shows, oxygen desaturation, how that affects down the road. And when airway is such a complex issue that you gotta win the small victories to get the patient on board, because so many people, it's a silent disease, it's a silent disorder a lot of times, and a lot of people don't understand the connection that sleep has to the rest of the body and whole health, and how it affects your cardiac output, how it affects insulin production and insulin resistance, how it affects digestion, how it affects mental fog, brain fog, how it affects your body being able to heal, how it affects cleavage of beta amyloid plaques in the brain. I mean, there's so many things that go into it. So you can't come at the patient with all that information. I mean, I almost put you to sleep just now, just describing all that. I mean, you gotta go with the small, simple things that people can understand and they can identify and they can get on board with, and then slowly show them how you can help with improvements. But you also can't promise them the world. You've got to under promise and over deliver. I'm never going to tell a patient that if I get your sleep apnea under control, you're going to get off your blood pressure medication, your diabetes is going to be super easy to manage. I know it's going to be to a certain extent, but I can't promise you the world. I know I can help you. I know I can get you an improvement, but those are also multifactorial things that have a hereditary aspect. They've got a functional aspect. They've got a habitual aspect. And so there's only so much we can do. We know we can get you help. We know we can get you improvement, but you have to be on board with that. You have to see the value in that before I can even start.
Yeah, I've seen sleep apnea is a really complicated issue too, and it seems like it's increased rapidly within society, or at least we're paying more attention to it.
We're identifying it more now. That's the thing. We know so much more, and we're now just now within the last couple of years, I feel like, realizing how widespread it is, and also the effects, how massively it affects the rest of your health.
If you're suffering from sleep apnea and you're ignoring it, all of a sudden it puts you at an increased risk. I don't have the numbers in front of me, but it can lead to stroke, it can lead to heart attack, it can lead to a lot of different issues, which is pretty severe. And a lot of people, I think, have no idea that they have it. And I
Absolutely.
recommend that the audience or anyone listening, if you have an Apple Watch, or if you have was it the Nuva rings or Garmin or Whoops, if you have something that tracks your sleep, pay attention, because you might find that your blood oxygen is desaturating below 90% at night. And that could be a sign of sleep apnea. Of course, it's not going to be the same accuracy as the at-home test that you were discussing earlier. But I think a lot of people at home aren't aware that, so what desaturation of the blood means is that you ideally during the day want to be well above, overall, you want to be well above 90% during the day. And at night, you want to stay above 90%. Anything below 90% means that your blood isn't carrying enough oxygen to actually restore the tissue. So if every night you're going to sleep and your blood oxygen is dropping, that can have severe side effects over time, chronically. And you're definitely, at the very least, can be very tired in the morning. But
Absolutely.
there's,
You're engaging that fight or flight, reflex in the body. Your body, when you stop breathing and your oxygen drops, your oxygen desaturates, your body feels like it's dying. It's trying to keep you alive because your brain should be sending the signal that you need to breathe. But if the airway is closed off, if you don't have a patent airway, that signal may not be strong enough. And so now you're getting the signal, but you're gasping because you don't have the tube you're trying to breathe through is tiny. It's a straw versus, something much bigger. That when you're constantly not breathing throughout the night, you're constantly engaging that fight or flight response. How are you going to feel rested in the morning? Your body is trying to keep you from killing yourself and dying multiple times through the night. So it is working overtime. And when you don't have enough oxygen, your organs don't have enough oxygen. And when your organs don't have enough oxygen, they're not going to function properly. And so your heart is stressing because it's trying to get more oxygen out to those systems to keep everything running. But over time, just little by little over time, your organ systems are not going to they're not going to continue to function properly because they don't have everything they need.
Yeah. The other interesting thing is that when you're waking up that frequently, you're interrupting your sleep as well.
Absolutely.
So all of a sudden, most of the time it occurs during REM sleep, correct? So you're after
Yeah.
REM sleep, you're not falling into deep sleep. So because you have this interrupted sleep, you're not having deep restorative sleep, or you're not even falling into REM sleep.
Right.
And these are the times where your body actually restores. So all of a
Yes.
sudden we bring it all the way back to what we were talking about at the beginning of this podcast, where we were talking about the negative impacts of lack of sleep. And now you're going to have increased injury risk. You're going to have poor hormonal balance. You're going to be chronically fatigued. So not only does it have those terrible consequences that you were mentioning earlier, but you think you're sleeping 6 hours, but you're really only getting 2 to 3 of quality sleep.
Absolutely.
So of course, very commonly we hear about CPAPs, and CPAPs are very beneficial. But what are some other recommendations you have for treatment of sleep apnea? Because you do have extra training in sleep apnea, correct?
Yes. My go-to treatment is an oral appliance called a mandibular advancement appliance. And so, like you said, when you fall into REM sleep, you lose muscle tone. And so your body's paralyzed at that point. And so a lot of times, especially for patients who sleep on their back, your gravity is going to pull your lower jaw backwards. Okay. And your tongue, which is a giant, huge muscle, massive tissue, is going to follow that lower jaw backwards. And so if your tongue is falling backwards and it's now shortening that airway and giving you a smaller tube to breathe out of, imagine breathing through a straw versus breathing through, an exhaust pipe. I mean, the bigger the airway, the bigger the tube, the easier it is for you to breathe. And so what we're doing is we're correcting the position of the mandible, the lower jaw. We're pulling that mandible forward because the tongue is attached to the floor of the mouth. And so pulling the mandible forward, the tongue's going to follow it. And so if we can get the tongue out of the way, most of the time we can keep that airway patent. And it's usually enough that the patient can do proper nasal breathing for themselves. It's very complex and nuanced. Again, CPAPs are great. Anytime I have a patient that uses their CPAP, I celebrate that with them. It's like, I'm so happy you use your CPAP. I want you to use that CPAP every single night. I don't want you to miss a single night. If I have a patient who is at the point where they're like, I hate the CPAP, I can't wear it. It's uncomfortable. It's, whatever gripes they have with it, you've got to do something, because we talked about all the negative effects of not treating sleep apnea can have on your body overall. If you're not treating this, you're taking time off of your life, and there's no other way to say it. And we've got data to prove it. And so if you're not going to wear the CPAP, the mandibular appliance is another great thing to go to. It's not for everyone. And you've got to be able to recognize that. And it's not for every patient that has sleep apnea. If a patient has severe sleep apnea, I tell them up front, CPAP is the way to go. That should be the first line therapy for you. There are some studies that will argue that. Especially if you have central sleep apnea. If that's a neurologic issue, your brain is not sending this signal for your diaphragm to breathe. It doesn't matter where I put your mandible at that point. It's your body's not breathing. It's not that your airway is closing. The mandibular advancement device is not going to do anything for you. You need supplemental oxygen. That's a neurological issue. And so being able to identify the patients that you can help, and even the patients that are in the severe category. I've had great success with patients, great improvements with patients that are severe sleep apnea patients, and getting them an improvement. And so giving them an option, if they're not going to wear the CPAP, giving them something that's going to help them in some way is better than not treating it at all. I'm helping them. I'm improving their oxygen saturation. I'm doing something for them that's going to be better than doing nothing, and that's going to help them live longer and be healthier. That's a big, super important to me. But it's the complexity for the mandibular advancement is the jaw, the TMJ, the musculature. We've got to make sure that we're working within the envelope of what the patient can handle and what their jaw and their muscles can handle. We've got to make sure that we're working with the TMJ, any symptomology. We're making sure we're not causing symptomology, because if I put you in a mandibular appliance and now your jaw hurts, are you going to be super happy with me? No, rightfully not. But there's also, you have to pre-frame the patient and understand where we have to put your jaw in a position that it doesn't want to be in. It wants to fall back because of gravity, because of all the other things that are working. And we may have to walk that line of improvement of the sleep apnea and dealing with a little jaw soreness. And what are you willing to deal with? What can we manage? And what's best for you? We've got to do something. We can't do nothing. That's not an option. It is an option, but it's not a good option. And so figuring out what that spectrum we can work with, and what the patient can handle, that's super important too. But it's all, again, it's pre-framing the patient, it's patient communication, it's patient education, and helping them understand the severity of not treating it, and helping them understand what I can do, what's the realm of possibility, and helping some patients understand that, look, the CPAP, you may hate it, but that may be what you need, and we can't argue that sometimes. It's the way it is. Every
So
patient's different. Every patient's complex.
what you were telling me is, I think, pertaining to the TMJ and what you're doing with the jaws, you might only be moving it about 1 millimeter at a time, correct?
Yeah.
So you
Yeah. I
make
usually
four.
start the patients in an edge to edge position, because that's usually a position that people can tolerate. And then I usually titrate them about 1 millimeter at a time if we've got to come forward. And then we do it slowly. We do it over, I'm doing it over months. I mean, I'm slowly but surely bringing the patients forward so we can stay within that envelope of what they can handle, but we're slowly opening the airway. And it's great when patients, like you said, they're wearing an Apple Watch, or they're wearing one of those rings, or something like that, that's giving them data. It's like, hey, your sleep is improved, your breathing is improved. And when they feel better and they recognize that they feel better, and they get on board and they see that we're making a difference, they're much more willing to work with me, and they're much more willing to tolerate a little bit of discomfort, because I tell them, we're only going to go as far as what you can tolerate. I'm not going to put you in absolute intolerable pain just to improve your sleep, because you're not going to be compliant with that. And so
Yeah.
we've got to work with what you can handle, and we've got to shoot for improvement. Even if we can't get fully to the no apnea range, as long as I get you an improvement and you're feeling better, then that's a success.
Yeah, and I think it's always important to mention the natural ways to improve sleep as well. Not that they're going to completely replace, because you can't help if somebody has a sleep apnea fully, but of course, little things to improve sleep is continuing to go to sleep at the same time each night,
Yes.
waking up at a similar time each morning, cessation of alcohol, or at least not having alcohol within 2 hours of bedtime, limiting blue
Caffeine as
light
well.
exposure around bedtime as well. So your cell phones, TV, things like that. All
Absolutely.
of these things are huge. Weight loss is always going to help with sleep. All of these things can help make a difference, and they can improve, I guess I would say, some severity of sleep apnea or things like that. Of course, sleep apnea, there's a certain stage where when you're desaturating, or when these things are you need to get an appliance, you need to be taking your CPAP, and you need to be doing these things.
Absolutely. Sleep hygiene is one of the biggest conversations I have with my patient. Is like, I
Hmm.
need you to go through your routine, because that's when I'm going to tell you all the things you're doing wrong. Because there are things that are wrong in routine when it comes to sleep. And so, yes, the appliance is important. Yes, understanding you have an issue is important. But just throwing a mandibular advancement appliance in there, throwing on a CPAP, isn't the full picture. We've got to address where a patient may be falling short in their sleep hygiene as well, limiting caffeine, talking about alcohol usage and things like that. It's a huge, there's no one factor. There's no one thing that just by, correcting this one thing, we're going to fix it all. So it's a big conversation. And again, you've got to get the patients to see the value in it, and you've got to get them on board, because there's only so much I can do. But when the patients are feeling better and they can get on board, I can usually get them to kind of critique their routine and change things, and it helps a lot when they're on board.
Absolutely. Is that the mandibular device also helps limit grinding of the teeth, correct?
Absolutely. We're elongating the muscles of the TMJ, the muscles of mastication. And so we know an elongated muscle is not going to easily contract versus a foreshortened muscle. And so we're limiting the amount of force that the patient's going to get, but also the appliance that I use, it's the Persomnus appliance. It is a medical grade material. It's a very, very hard and thick material that can stand up to grinding or clenching habits and things like that. And even if you are continuing to wear, you're wearing the appliance. You're not wearing tooth on tooth. Tooth enamel is the hardest substance in your body. It's the hardest substance your body makes, and it will wear against anything you put it against, including itself. Enamel is going to wear on enamel. So when you put something, a cushion in between the teeth, you are protecting the teeth from wear. When you're putting the jaw muscles in a more elongated position, when you're seating the jaw, the TMJ properly, you're preventing those parafunctional habits that can cause those issues as well.
Yeah, absolutely. And so that can actually help with TMJ dysfunction, right? This isn't the same device you would use for somebody that is grinding in general, though, correct?
Not necessarily, because when a patient doesn't have an airway issue, when they don't have sleep apnea, we're not changing the position of the jaw necessarily. I don't have to pull that TMJ patient forward. Sometimes we want them to go back. We want that jaw to seat properly. And so pulling them forward may not be the proper treatment for them. But you got to be careful. You got to understand how the joint works, how the muscles work. Because if you have an airway patient, you've got a sleep apnea patient that's coming in and complaining of TMJ pain, and you give them a splint, a flat plane splint, then now you're making it easier for them to slide around. And part of the issue is the lower jaw sliding back and closing off the airway. Well, guess what? You just made it easier for that to happen. So now you've made their apnea potentially worse. So you've got to be able to identify those patients, and you've got to be able to know, is this just an airway issue? Is this just a joint issue? Is this a muscle issue? Is this a complex combination of them? But also you've got to be able, when it comes to TMJ, you've got to be able to identify, is this a muscle issue? What muscles are causing the issue? Is this a skeletal issue? Because if it's a skeletal issue, you attack that completely different than it is if it's a muscle issue, because you're going to make it worse. If you treat it, you cannot treat it all the same way. If you do, you're going to make patients worse.
So is there anything that you do outside of the wisdom teeth, like from a dentistry perspective, that really provides preventative wellness?
Absolutely. We give dietary nutrition counseling at all of our hygiene visits. I never come in at a patient and tell them, look, you can't have sugar. You can't drink soft drinks. You can't drink coffee. You can't do this. I'm not going to stop doing that. I'm not going to tell my patients to stop doing that. It's understanding how to approach it in a healthy way and how to have a healthy relationship with those not so healthy things, those not so healthy habits. And so a lot of patients don't understand that if you're sitting at a desk and you've got a Coke and you're sipping on that Coke throughout the day, you are bathing your teeth in sugar and acid throughout the entire day. Okay. That is a huge difference than sitting down and drinking that Coke in a short amount of time. Enjoy your Coke, drink the whole thing. At the very least, when you're done, rinse your mouth out with some water. Just rinse the sugar off the teeth. Give yourself a couple of minutes. Let the pH of your mouth go back to normal, become a little more basic again, a little more neutral, and then go brush your teeth. That you can enjoy those things. You can still indulge in those things in a healthy way that's not going to be detrimental to your teeth. I can tell when a patient comes in and they've just got rampant decay everywhere. And I start talking to them about their habits. I'm like, tell me about your diet. Tell me, are you sipping on Cokes or coffees or teas? And then some patients are like, well, I do unsweet tea. It's like, yes, I do lemon and water. It's like, yeah, okay, now we've got to talk about acid. Now we've got to talk about the acidity of your mouth, because that's got a factor that comes into play as well. So it's not that people can't have those things. They can't enjoy those things. I'm going to enjoy those things. It's how to do it in the proper and healthy way. and just educating people. You don't know what you don't know. No one's telling the patients this. So my hygienists, our hygienists are great. They come in and they tell these patients, and they also cover proper brushing technique, proper flossing technique. We address if a patient's on multiple medications or if they've had some head and neck radiation or things like that, and now their salivary flow is limited. Now we've got xerostomia or dry mouth that we're dealing with. We've got to approach this patient completely different. Nuance is the biggest. No patient is the same. And so now, we've got to talk about fluoride. We've got to talk about brushing habits. We've got to talk about patients who tend to build up calculus or tartar in a faster way than some other patients. It's like, well, maybe we should see you every 3 months or every 4 months. Maybe the 6 month isn't enough for you. That, insurance comes in and being an issue. What if insurance is only going to pay for every 6 months? Not every patient is an every 6 month cleaning patient. Some patients need that treatment, sooner. And so we work with patients as best we can to help them be as minimal out of pocket as they can. If they have insurance, we want them to be able to use it. You should be able to use that benefit, but insurance is not meant for catastrophic care. Insurance doesn't cover preventative treatment most of the time, which makes zero sense to me. Prevention is a difficult thing because a lot of patients don't understand the benefits of it. A lot of insurances don't cover it. So again, that's a get the patient on board, help them see the value in it, help them understand that, yes, this night guard isn't cheap, but doing a mouthful of crowns when you've destroyed your teeth due to bruxism is even way more expensive. I mean, we're talking exponentially more expensive. So if I can prevent you from getting to that point, I'm for it. I'm here if you need a mouthful of crowns, but I'm not doing my job if we're not at least trying to prevent you from getting to that point. And so prevention is massive. It's, again, my hygienists are usually spending more time with the patients talking about prevention because they see the patients more than I do. Patients see my hygienist way more than they need to see me, which is a good thing. I mean, I want you doing these preventative services so you don't have to see me. Nobody likes coming to the dentist. Nobody likes getting a shot in the mouth. Nobody likes the sound of the drill. I get it. I totally get it. So if we can keep you from needing that, and we can spend more time doing the things you want to do or help make those visits happy to where I'm not telling you all the things that you're doing wrong, that's so much easier of a visit for the patient, and that makes the patient experience so much more easy. So they're more willing to come back.
Absolutely. I think one of the more interesting things that you and I have talked about was just how simply like rinsing your mouth out with water and how not consuming because I love my morning coffee. I go to the office and because I don't like to have my coffee first thing in the morning. I like to wait about 90 minutes or so to let my hormones kind of wake me up and to let everything wake me up. And so I start having my coffee when I get to the office. But all of a sudden that certainly, if you're just sipping coffee all day, it has the same effect as the soda. Now, I'm not going to go just chug my coffee in a matter of 15 minutes, but I try to finish it within a certain time window and then making sure to drink water afterwards because water is actually amazing for us.
Absolutely.
What's your thoughts of, I've read in some places that even like a xylitol gum can actually be beneficial.
Absolutely. I really, really utilize xylitol in my patients who have xerostomia, who have dry mouth, be that, head and neck radiation patients who have had more on multiple medications that affect the salivary flow. There's a great product called Xylamelts they're little xylitol tabs that help stimulate salivary flow in the patients that have reduced salivary flow. Because even if you're, sticking to the realm of those habits that, have healthy habits with sugar and with soda and things like that, those patients are so much more prone to having issues, even with a healthy relationship with that, just because their salivary flow is so much reduced. And so xylitol is great. It's a sugar alcohol. The bacteria in your mouth cannot break it down in the same way that it can glucose. And so when the bacteria in your mouth break down the sugar, normal sugars, they produce acid, which is what weakens the enamel and creates the spot where that can cavitate and then cause decay. Xylitol can't be broken down in the same way. And a lot of those sugar substitutes, sorbitol and things like that, are the same exact way that your bacteria in your mouth and your body aren't processing that in the same way. So you're not getting as much of the detrimental effect that we can get from taking in too much of sugar or other things like that. So it's great. I know a lot of people are like, oh, it fights cavities and things like that. It's like, just be careful. Be careful the way you're framing that, because it's not a substitute for good oral hygiene. Chewing xylitol gum is not the same as brushing and flossing your teeth. Don't ever get that, in your head that, oh, I can just chew some xylitol gum and I'm going to be good. It's like, no, it's a better substitute for chewing on sugar gum that, Bubblicious and things like that. But it's got its benefits, and it's a good thing. It's a good substitute for those bad habits, but it's not a replacement for other good hygiene practices.
Very cool. Very cool. Is there any misconception in dentistry or something that you find that people come in that you just wish the general public or other physicians was aware of?
Well, that's such a loaded question, and there are so many things. There's so much, and we talk about misinformation and disinformation in Wellness Academy all the time, and how we've got so many people have such a big platform and a big megaphone to spread these things. The fluoride issue, it bothers me a lot, especially from a public health perspective, because there are so many underserved areas or impoverished areas where, especially kids, man, they're so at risk for tooth decay. And so when we've got fluoridation and we've got fluoride products that can kind of help maybe try and bridge that gap, maybe try and up the coverage to prevent things like this, it's invaluable in that population. You've got to understand the dosage in parts per million. I mean, we're talking parts per million. We're talking such a low amount that has such a drastic benefit. Too much of anything is bad for you. You can drink too much water. That can be bad for you. But that doesn't mean water's bad for you. It's, unfortunately, I think we've lost the ability to understand nuance in a lot of things and understand that we need to trust the experts, and we've got to trust the research that's coming out. And everybody's got their own opinion. Everybody has the free will to form their own opinion, and that's fine. I'm coming at you with evidence-based, scientific backed research. I'm going to tell you my professional opinion. And now it's up to you to make that decision. I mean, I wish more people understood the benefits that fluoride has on oral health. Another one is radiation. When it comes to x-rays, patients are like, oh, I don't want to be exposed to all this radiation and stuff. I get it. I get it 100%. The technology we have now the radiation exposure is so minimal. If you come in and you don't want x-rays, you may as well cover my eyes and ask me to do an exam for you. You turn the lights off, let me close my eyes, and now let me check your teeth and see if there's anything wrong. You are taking away a diagnostic tool that I have to tell you about your oral health and tell you about things that need to be addressed. And when you take that away from me, I can't do my job fully. And I tell patients that. It's like, look, I only know what I know. I can only see what you allow me to see. And if you take away what I need to make a diagnosis, then I can't make a proper diagnosis. And I can't be held responsible for that. I can't fully tell you what's wrong. I can't fully tell you what's there. I can't help you if you don't help me help you. And so I'm in full agreement. Only as much radiation is necessary. But our radiation levels are so minimal now, it is not a risk to the vast majority of the population. There are some patients who should not receive any radiation beyond what is absolutely necessary. And we've got, lead aprons and things like that when that's needed. We've got plenty of research now that tell us not even lead aprons aren't necessary for the majority of the patient population now with the x-ray technology we have, which is great. That's phenomenal. That's awesome. But I'm not coming in and I'm not zapping the patient 1,000 times. It's very quick. It's very concentrated. It's very minimal. Just to get enough information that I need to give you a proper diagnosis and to fully do my job. That's all I ask for. Don't put my hand behind my back and then want to hold me accountable for what I can't see.
Do you have any final book or any documentary or any layman's information or that you recommend for the public?
For the public is tough. Like you said, the book that you mentioned earlier, The Art of Breathing, and that's great for patients who want to understand a little bit about how airway and breathing is as an effect on the entire body. I really like the book Gasp. I showed you guys that book when I
Yep.
gave the talk on sleep apnea. That one's great. It's tough to give that information on a level that someone who hasn't had the proper training to understand, because these are really, really complex issues. And so the number one thing that I want patients to understand is find a provider that you trust. Find someone whose judgment and expertise that you trust and come to them with questions, because they're going to be able to answer what you want to know. They're going to be able to put it into terms that you can understand, and they're going to be able to fill in the blanks of the knowledge that you don't have, and try and make it understandable for you, because you start to look at sleep and you look at the effects it has on the brain and all the neural pathways, and that's getting over my head in a lot of instances. I mean, that is difficult for me to understand. I try my best. I listen to the experts. I listen to the people who that is their thing, because they can make it understandable for even my level. Dropping that down to a patient level is even more difficult. Be careful Googling things, because you can nowadays, with how vast the internet is, with how crazy social media is, you can find an article, you can find a person, you can find research that will back up any claim you want to make. 100%. You can claim that, walking out in the sun is going to make your head fall off. You can find someone who's going to be willing to say, yeah, that's true, to get clicks and to get engagement. And that's unfortunate, but that's the world we live in. So again, find people that you trust, find practitioners that you trust their expertise. And if you find data or research that you want to know if it's true, go to them with it, because a good practitioner, any practitioner worth their weight in anything, is going to also tell you when they don't know. You've got to be able to say, look, I don't know. I honestly don't know. Let me find out, because all of us have people who are smarter than us that we've learned from, that we can reach out to, that we can find answers for. And you've got to be able to say when you don't know, because you can't, the patient, you're not doing them a service when you're just faking it until you make it. If you don't know, be honest about it and find out. It's your job to fill in the blanks where you need to, and to get the patient the proper information and the proper data, so you're helping.
Yeah, I think the Google topic and the AI topic is very complicated and is only going to get more complicated. But I think for me, I always recommend, I actually really do like when patients try to educate themselves as much as they possibly can, whether it's on Google or things like that. As long as, and I think this applies to just everyone, as long as we maintain an open mind and maintain open dialogue. So if somebody comes in and they've got a lot of questions about some YouTube video that they saw or something like that, a lot of times that can actually help the information that I want to portray, because they already have a decent amount of background in it. But sometimes I think a lot of the videos or a lot of Google or a lot of these things are focusing on very specific cases, or very, you see a lot of podcasts talking about optimization, or you see a lot of these scenarios, but it's if you're trying to lose weight, maximizing, certain hormones isn't step one. A lot of times we need to, if we're trying to, we need to start you need to master the fundamentals before you
100%.
can do things. And I think nowadays there's so much information just floating in front of everybody that it's confusing. It's consistently confusing. We're following content, we're listening to podcasts, watching videos, and we're just throwing information. And a lot of times we're not learning how to apply it. And I think that's one of the goals of this podcast and the Wellness Academy in general, is so that we can all kind of teach people, whether it's the lay population or other doctors even, how to apply or understand or pierce through all of this data and just make sure that the fundamentals are down pat, while also being willing to communicate, teach each other, learn from each other, and maintain open minds.
Yeah, you've gotta understand too, and the biggest thing is, it's so easy to do your own research, but when you get into the weeds of things, it's like you've got to be qualified to really really be able to nitpick whatever research you're looking at. You've got to look at it from several different angles. You've got to be able to try and tear that research apart before you can trust what it's saying. And your healthcare practitioners have been trained to do that. I spent time in dental school. We have a class called evidence-based dentistry. In our histology class, we spent an entire portion of the semester where our instructor gave us terrible research articles. He's like, tell me why this is bad. And so you're learning how to critique and how to identify when something is not necessarily truthful, when it's biased. And you've got to be able to recognize that, because if you just take every title that you read at face value, you're not truly doing the research. You've got to take the time to question it. You've got to take the time to understand if someone's trying to sell you something, you've got to understand that angle as well. So it's not a simple topic at all. That's why my biggest thing is find healthcare practitioners that you trust their judgment, you trust their expertise, and come to them with questions. Because if they know the information, they're going to make it easier for you to understand. They're going to give you the facts and what we know. And if they don't understand it, they know people that can help them understand it so they can help you understand it.
Absolutely. Absolutely. Well, this has been an absolute pleasure, Dr. Williams.
Thank you, man.
I really appreciate you coming on.
Yeah.
I knew
Thanks
we
for
had to have
having
a
me.
conversation like this after we had lunch at Roosh Creel, and
Oh, yeah.
we spent an hour just diving into all these
Yeah.
topics, and it was a ton of fun, just like this was. So
Absolutely.
Thanks for coming on, and I appreciate you showing up, and we'll have to have you on again shortly.
Well, sounds great. Thanks for having me, man. Appreciate it.